My name is Steve Dann. I'm the co-founder and chairman of Medical Realities. My background originally in film and television technology, and that led me into working in augmented reality and virtual reality. And about 5 years ago, I had the very good fortune to meet Professor Shafi Ahmed at an event at the Google campus here in London. And we started to talk about the problems in healthcare and healthcare training. And really, we haven't stopped talking since. We started to focus on how new technology could make meaningful changes in these areas. And we decided we'd try something. We'd try and harness the power of virtual reality to help in the education initially of medical students and healthcare professionals. That's brought us to Medical Realities. Our solution has grown into a platform for training and education using extended reality, about which I'll talk a little bit more later. Really, why did we choose virtual reality? And extended reality is just a more sort of souped up version of augmented reality and virtual reality. And we're very excited to be able to use that and use all its interactive properties. Now, why did we choose this and why now? Well, it's a sort of extended reality is an excellent providing top class training and education that has proven benefits in really sort of how people are trained, but also the actual sort of how they easily fit into that training process, and also how quickly they learn, but also how they also retain what they've learned, which is very important. It enables us also to conduct real-time research and monitoring of the use and effectiveness of our training modules. It also helps us in the prevention of clinical mistakes, hopefully going forward, because a better trained workforce is obviously a better workforce all round, and that's very important in the healthcare sector. It also enables us to share our knowledge on a global basis, which is something that we're really keen on doing, about sharing what we know and sort of helping other people and other countries, because this allows us to have a network of a global network of medical students and healthcare workers now, which we're continually adding to. And in the future, we see it's going to enable us to add therapies to the list of the user modules and training modules that we're creating. So Medical Realities is seen as one of the top disruptive companies in the medical sector in the world. And we want it to be open and as accessible as possible. We can easily change and adapt our training modules very quickly. That's another reason why we've chosen to use the type of platform that we've created. And our platform is entirely scalable on a global basis, so we can reach and talk to as many people as we want. So far, our sort of live record is around about 55,000 people. But normally it's we're actually sort of live to sort of anywhere between 200 and 1,000 people at any one time. And it can be delivered to anybody who's got access to the internet or has a mobile phone. And last but not least, it's the most cost-effective method of delivering training and education that we found. So I'm into that platform, and our platform is designed to run all our virtual reality training modules, and they're coming in lots of different guises. They could be 360-degree videos, they could be simulation work, but the platform is also designed and developed to actually sort of accept other people's content as well. So any content that's created by other third-party developers in virtual reality or augmented reality can actually run on our platform with ease. thought I'd just quickly touch on a couple of sort of B2B medical training things that we're doing. We're working with AIMS, which is an Italian university, which actually has two campuses, one in Bari in Italy and one in Madrid in Spain. And we've actually worked very closely with them to conceive and deliver a virtual reality curriculum based on their particular educational needs. And this has proved very, very useful. In fact, a lot of us, I think we've got probably over 2,000 medical students, because it's not only students that are at university that have used our platform. Also, they tend to stick with the platform to see what other things are on going forward, which is great. And we've also got an ongoing program actually for training ward staff in conjunction with Health Education England. This is a project for training, and it's something that we're really, really happy with going forward. On the global side, we've been working with the University of Leeds and the National Institute of Health Research to provide virtual reality training for particularly surgeons in Sierra Leone, because they have some particularly pressing needs for extra and precise education. And also we're working very closely with the Eden Multicare Hospital in Bangladesh to help train their surgeons and create a sort of larger hospital, because they wish to grow that hospital as much as possible. And we're very glad that they've chosen our platform to do that. So our global impact has been profound, and that I think that shows how we've been going forward. Our medical reality platform is used for ongoing training and education around the world, as I said, and we wish to expand out and partner with people. So we're always open to listening and partnering with people in the healthcare sector. And last but not least, I see extended reality in healthcare as being the future. Thank you for listening to my sort of little talk, and here's all my contact details if anybody needs to get in contact with me, and thank you for listening.